Hello and welcome to Endemic Times. My name is Amira. Earlier this week, over 7,000 New York City nurses went on strike. Why were they going on strike in the first place? From horrible staffing problems and general working conditions, in addition to low pay in comparison to executives, some of those executives making over $6 million, the sheer amount of patients per nurse having to hang IV bags from curtains. It's been a shit show. Luckily, the strike has come to a close for now with a tentative deal between the unions and the corresponding hospitals. But this strike exposes a much deeper issue that's happening all across the United States, and that has to do with low salaries and wages across the board, where people are not making enough money to live. And it's not just what people consider low wage jobs like food or customer service jobs that are some of the least paid positions. But across the country, mid-level jobs in the United States, wages are not keeping up with the skyrocketing rents and utilities, inflation and price gouging by big corporations that are jacking up prices on basic necessities like groceries, along with increased healthcare costs, etc. Middle America is getting pushed down farther and farther, while the richer get more, pay less taxes, and continue to squeeze the American dream away from some of the hardest workers in the country. The hard work that is being done at the bottom is not benefiting those workers. It's benefiting the executive and professional managerial class, shareholders, board of directors, but you, the worker, it's not benefiting you. And that is the overarching theme when we look at the nursing strikes, the rail workers, the baristas, the truckers, you name it. It's all connected to the biggest issue, that trickle-down economics is a load of shit that isn't working, and our politicians suck at doing anything about it because they are being paid by these big corporations, big healthcare, to keep the system the way that it is. It's time to make the rich uncomfortable, and that's why these strikes are so important and have to continue. Now let's get into it. Following what was the largest nursing strike in decades in New York City, tentative deals reached between the New York State Nurses Association Union and Mount Sinai Health System and Montefiore Health entails the following: a deal providing enforceable safe staffing ratios for all inpatient units, so there will always be enough nurses at the bedside to provide safe patient care, not just on paper. And Montefiore has agreed to financial penalties for failing to comply with staffing levels in all units. This also includes 170 new nursing positions, a 19.7% increase in pay, lifetime health coverage for eligible retirees, and adding significantly more nurses in the ER. One of the most common and frankly concerning themes coming from nurses is that of the short staffing levels. Lorena Vivas even stated that we are not out here for wages, we are out here because we want patient safety. She continued on saying that she was often caring for 3 or 4 patients at a time in intensive care instead of the 1 or 2. And this was happening before the pandemic. The pandemic just blew the whole thing open. At Mount Sinai, where a tentative agreement has now been met, some nurses could care for as many as 18 patients at a time, with some patients being kept in the hallways. This is an enormous safety issue and care issue. We cannot expect someone to be taking care of this many people and expect nothing to go wrong. One practitioner even said that anything can go wrong. We are human, we're not machines. Another said that the patient-to-nurse ratios are unsafe, and every time they go into work, they are scared for their license. Another personal account details one nurse caring for between 8 and 10 patients at a time. A nurse practitioner said that she sometimes skips bathroom breaks to attend to patients. Another nurse said that her 12-hour operating room shifts frequently become 14-hour ones as low staffing levels push workers to take on longer shifts. We love our job, we want to take care of our patients, but we want to do it safely and in a humane way where we feel appreciated. Appreciation goes a long, long way, and it's so often left out because businesses don't see empathy and compassion and appreciation as a necessary part of the business model. Since our healthcare is run like a business here in the United States, and since compassion and empathy are all but gone in most businesses, this is why we're seeing what we're seeing in the medical profession and so many other industries, because the executives and fat cat CEOs have made it abundantly clear that they don't give a fuck about the workers. They just want them to shut up, get to work, get paid the least amount they can under legal parameters, and walk away with their millions, second personal jet, corporate retreats, low tax brackets because they're rich. I'm not mad at seeing this disparity at all. I don't know what you're talking about. There is a national shortage of nurses and doctors that has predominantly occurred because of the pandemic and the overall lack of staffing and care that these workers have received. According to a 2022 survey by ShiftMed, about 2/3 of nurses said they were considering leaving the profession within 2 years. This is a big reason why the staffing levels have gone so low and are getting harder to replace. At Montefiore, there were over 700 openings before the agreement with the union and 500 at Mount Sinai. And at these two specific locations that remained on strike until Thursday, another aspect of this problem has been a difference in pay compared to other locations. Nurses at Montefiore and Mount Sinai have been earning much less compared to nurses at other campuses. And something tells me that what finally really got these hospitals to get to the negotiating table was the fact that things seemed to get even worse in the hospitals as the nurses went on strike, which is the point of a strike. An ER nurse stated her work environment resembled a New York City parking garage with rolling stretchers stacked several deep, and in order to reach patients, nurses have to pull down the rails of the stretchers to squeeze between them. Also, because of a shortage of poles for intravenous fluid bags, nurses sometimes have to hang the bags from the walls and curtains. Granted, this is likely what was taking place before the strike, but when the reality finally gets into the minds of managers and assistants that aren't normally on the floor, they quickly get upper management to change course because they don't want to do that hard work, which is the whole point of these strikes. It's to get people uncomfortable that for too long have gotten way too comfortable profiting off of the hard work of others that are not getting the compensation and care they deserve for the hard work that they are doing every single day. This is what nurses at Montefiore have been wanting the management to address: the problem of overcrowding in the ER and boarding patients in hallways. And of course, the better patient to nurse ratio that is enforceable. Before the Thursday tentative agreement, nurses could file a protest letter when they were asked to care for more patients than in the last union contract. Those letters would be signed by management and hung up on the wall, something that happened so frequently it was sometimes referred to as wallpaper. So why has all of this been happening to nurses? Well, the biggest thing here is the fact that healthcare is a business. It's not about providing health care. Hospitals do not have strong financial incentives to invest in their nursing staff. Under our current fee-for-service model, physician services can be billed by the hospital, and hospitals have every incentive to expand on those services, but little to hire more nurses to support that work. Sadly, hiring more nurses and making their work environment better doesn't necessarily make good economic sense for these hospitals. From the hospital accounting perspective, nurses are just a cost. They do not generate any revenue directly, even though they are so necessary in providing quality medical care. Even though research shows that when nursing staff levels is higher, patients report better experience in the hospital and better health outcomes overall. But better health outcomes means less money for big health and big pharma. So this is why having a profit incentive model for healthcare is diabolical, in my opinion, because it only creates more predatory tactics, allows for physicians to over-medicate, not do early diagnoses, and preventative treatment, and especially anything more holistic that is not beholden to big pharma, is looked at like it's a conspiracy theory practically. It's a disgusting model that we need to end. Medicare for all. The saddest part of all of this is that when you're in the emergency room, that cancer clinic, that children's hospital, you're not there because you're having fun. You're there because of horrible circumstances. A father that is terminally ill, a child with a new unknown illness, a friend that got in a horrible car accident. This is the most sensitive and heartbreaking moments of people's lives that take place in these institutions. And these institutions can send you away if you don't have the right health insurance. If you're a Black woman, your ailments are not taken as seriously as others. You can be improperly medicated because a nurse is working on their 16th hour and they are exhausted. This is not how this should be, and it doesn't have to be this way. It doesn't. Looking at the Montefiore Hospital specifically, the CEO makes $6 million a year, and a $38 million land deal in White Plains was in the works. Not really sure where that stands now, but this is the kind of exorbitant wealth and money that is being paid and spent by these hospitals instead of ensuring that hospitals have all of their staffing needs met. but because nurses do not generate any additional revenue for their hospitals. Hospitals across the country have a stronger financial incentive to keep the nursing staff as trim as possible, which is why we see the burnout, exhaustion, and leaving the profession entirely that we are seeing. There is no economic incentive right now for hospitals to invest in adequate staffing and paying nurses well, or providing a good working environment for nurses. This just makes me so sad and mad. What do you think of all this? Now let's take a real quick look at what the average nurse is making here in the US. On average, a nurse practitioner makes $43.66 an hour based off of Indeed. The low is in the $28.50 range and the high is around $66 an hour. But keep in mind, this is only an average and does not take into account the cost of living of the particular area in which a nurse is residing and working in. For example, the average RN salary in Puerto Rico is the lowest, coming in at $35,690 a year. In New York, the average RN salary is $93,320, which is an average hourly rate of a little over $44 an hour. Again, this does not take into account the cost of living, and this is an average. And looking at the agreement between the unions and the hospitals with these most recent strikes, the salaries that they are agreeing to is $51,000, which is $42,320 less than the supposed average salary in New York. In California, the highest paid average for an RN is $124,000. But the thing to keep in mind here as well is taxes. Taxes and cost of living are going to have major impacts in hourly and salary wages and the take home at the end of the day. There is also the cost of transportation. We know many of these nurses are not going to be able to afford to live in the places for which they work. So when you start to take on the costs of transportation in addition to costs of living for rent, utilities, and groceries, just those things alone before you even get to medical costs, car insurance, if you have kids, if you have an ill or invalid family member, these wages might seem high at the start, but once you start to factor in all the other costs and taxes, that number goes down dramatically. And then there is the actual cost that it takes to become a nurse. There is no set cost for nursing school, and your wages will correspond to the amount of education that one gets. So that means that if you spend only a couple $1,000s, your wage opportunities are going to differ from someone that goes to a private school, for example. And these programs, depending on community college, or private institutions, can range from the thousands to as high as $80,000 and even $100,000 for longer or grad school programs. When looking at nursing school cost by degree, an associate's degree can cost between $10,000 and $40,000. A bachelor's degree ranges from $72,000 to $104,000 for a private institution. To get a master's, you're looking at an average cost at around $48,000 for a public school and $108,000 for private. And let's keep in mind that these costs do not include room, board, books, and your ability to live while getting this degree, which is why people take out loans, work 2 jobs, and we wonder why people are so burnt out. We wonder why people can't pay back their loans because the wages do not correspond to the cost of the education. Education costs across the country in almost every area of study is increasing, which is another discussion for another day. But when you see this, does this not enrage you? Do you not see this disparity either? Those people that are still acting like going into debt to pay for college is wrong and that you don't have to do that, show me the numbers. Show me how people are supposed to be able to afford an education and then after all of that education, still not have wages even meet the cost of that education. Make it make sense. This is why there is such a shortage for nurses and less people entering the field overall. Anything in the medical field leads to a highly intense work environment. And this particular field requires higher education, and the cost of that education with the corresponding wages is not keeping up. People don't want to go into a field where the pay versus the cost of education and certification do not provide more of a benefit. If we think about this in business terms, you have to spend money to make money. A lot of people have to invest in themselves, which means you either have to save what you may be able to save from your likely low earning wage job, hence why you're going into the field or looking to improve your employment opportunities, or take out a loan in the hopes that by investing in yourself and your education, it will elevate you into a better wage position, which will then allow you to pay off your loan and save and be able to maybe in the long ago be able to afford a home at some point in the future. But the problem, as we will see here, is that wages for workers in the United States, regardless really of your education level, are not meeting with the cost of living. So by going into debt and trying to elevate yourself and your family by investing in yourself, you are actually taking a bigger risk in this time than you would have been even 20 years ago because of how expensive everything is. And let's talk about the cost of living crisis, because it is a crisis. It's not made up. It's not fake news. It's fucking real. And we're going to get into the numbers. There is no state, county, or city in the country where a full-time minimum wage worker working 40 hours a week can afford a 2-bedroom rental. A full-time minimum wage worker can afford a 1-bedroom rental in only 7 of all US counties. That's 218 counties out of more than 3,000 nationwide. A worker would need to earn over $24 an hour in order to afford a 2-bedroom home at fair market rent. And over $20 an hour housing wage would be needed for a 1-bedroom. A housing wage is the amount a worker would need to earn to afford a home without spending more than 30% of their income on rent and utilities. And these wages are for what they call modest homes in their area. I don't know what they mean by modest, but it sounds a lot like shitty landlords that don't do necessary upkeep, that allow mold to fester and seep into the walls, that eventually makes you sick and gives you black mold. This has happened to people I know. I'm not making this up, and this is why it pisses me off so much. Looking nationally, the average fair market rent is over $1,000 for a 1-bedroom and almost $1,300 for a 2-bedroom. But the average renter's hourly wage is $18.78 an hour, an income that can only absorb about $977 a month in rent without being housing cost burdened. If you're a household living on one minimum wage income, they can afford even less, $377 a month. I don't know anywhere that is that cheap that one would actually want to live. A lot of people live places they don't want to live out of necessity, and that necessity is getting more and more commonplace, hence the homelessness crisis. In California, where minimum wage is $14 an hour, cost of housing is so high that it still has the highest housing wage, where a person needs to earn almost $40 an hour to afford a 2-bedroom apartment and $31 an hour for a 1-bedroom. A minimum wage worker would have to put in 89 hours every week just to afford the 1-bedroom. And keep in mind, this study was done during the early days of the pandemic. This has nothing on our current situation with inflation, the high cost of gas, utilities, and groceries, the recession that is pushing wages down even more. I mean, need I go on? Anywhere in this country, the average a worker must make is over $24 an hour, or over $51,000 a year. This means that the New York City nurses that finally got to the table a wage of $51,000 are barely meeting the national average. And mind you, they are in New York, which again is one of the most expensive places to live in the United States. We are in crisis, and too many are working too hard to even realize how screwed over they are getting. The bottom half of US earners, which is around 165 million Americans, collectively held $2.2 trillion in wealth as of 2020, meaning that 713 billionaires, which I'm pretty sure has now gone up since this reporting, now hold over double the amount of wealth that the entire bottom half of American earners do, while paying less in federal taxes than the average worker. This is the problem. If you are not going to give people a living wage or healthcare for all, then you need to tax the rich. This is why all of our politicians are feckless cowards beholden to their donors, and they are more than happy to bend the knee and kiss the ring and take that money, money, money. Keep the strikes coming. A general strike is honestly what we need. The only way that things will change is when the comfortable are inconvenienced, and they are starting to be inconvenienced. Enough is enough of working your hands to the bone and getting nothing for it. The time is now. General strike, people. Well, thank you so much for watching and listening to me rant and get all heated about this. When I see this level of inequity and people trying to gaslight us saying that this isn't what's happening when this is the reality that's happening, I just get so upset. So let me know down in the comments below what you think about all of this. Hit that like button. Make sure you also subscribe. And as always, remember to stay safe. Take care and be kind to each other. Wow. You did it! I did it! Go me! No flubs. Woohoo!